Hello, today we're going to talk about bottle feeding and how to choose the right size nipple. A lot of parents come in and they're like, okay, I'm ready to learn how to use the bottle and how to train my baby to take a bottle instead of the breast. I'm going back to work, or daddy wants to feed a bottle sometimes. And so usually I'll tell parents somewhere between 3 and 6 weeks is a good time to offer a bottle. And once you learn how to give your baby a bottle correctly, there is a correct way. Once you learn how to do it correctly, then I always suggest that you do it at least once a day, or maybe 3 or 4 times a week, just to make sure that baby still knows how to take the bottle. Because a lot of times mom and dads will say, I tried the bottle and the baby took it just fine the first month, and then 3 months later when they went back to work, baby refused to take the bottle. So I just want parents to understand that there are options on the types of nipples that you use. A lot of parents will wonder what kind of bottle, and sometimes I say once the baby knows how to take a bottle, it doesn't really matter if baby can go from breast to bottle and back and forth, bottle to breast. But in some cases, I do have a preference on what kind of bottle I like to suggest the parents use. But let's just say in general, if you're a mom that is breastfeeding and you want to start introducing a bottle, I would say that try to match the flow of how your milk comes out of your breast. So if you have a slow letdown or you have a slow flow, then you want to probably use like a size 1 nipple. And if you have a fast flow or a quick letdown or an abundance of supply and your baby eats really quickly, let's just say your baby eats in less than 15 minutes, or anywhere between 5 and 15 minutes, you're going to probably find that your baby will be frustrated if it was a too slow of a flow of a nipple. In other words, you would want to match the flow with the flow of your breast. And sometimes you don't know what that looks like, and I would suggest getting a size 1 nipple or a size 2 nipple, put water in it, turn it upside down, and watch it drip. The other way to find out is try giving it to your baby and see how well your baby handles it. Your baby should stay relaxed. It shouldn't cough, choke, sputter when taking a bottle. And one of the most important things about giving your baby a bottle is making sure they're not staying on their back. A lot of parents will put the babies in the crook of their arm, and then the bottle's going straight up and down. If the bottle's going straight up and down, it's like a waterfall coming straight down at them, and it can be overwhelming. I do like to have babies feed in the beginning, feed on their side as if they were breastfeeding. If that makes sense, you would have their back up against your tummy, or you can lay them across your lap, long with their head towards your knee, and on their side, just as if they were on their side in a cross cradle hold at the breast. And the reason why I suggest that is it does help control the flow of the milk flowing. You want to make sure there's still milk in the nipple, but you don't have to drown your baby. And a lot of parents find that the baby actually enjoys taking the bottle a whole lot easier. So again, just a quick tip, match the flow with the flow of the breast. Now, if you're an exclusively pumping mommy and you want to give your baby a bottle from the very beginning, you may want to start off with either a preemie nipple or a size 1 nipple. And if you're struggling with this, you need help, I would highly recommend that you reach out to a lactation consultant and see if they can do a feed training session with you. And I will bring parents in. They'll have different bottles, and I will experiment with different bottles with them, showing them the difference on how to use it. Some nipples have very long, like a long tip, and some of them have a short, stubby one. So if it's long and narrow, the baby's going to most likely be sucking on it like a straw. And if it's short, they will be able to get on deeper and actually compress part of the bottle. And I like that one better because it helps the baby use the mouth more like they are doing it at the breast. So anyways, That's my tip for the day. If you have any questions, please reach out to me or your local IBCLC. All right, have a blessed day.